Now, I think some people, and this is true, help educate me and our listeners and viewers. Some midwives deliver babies at home. You
Yes.
deliver babies at the hospital. Can you tell us a little bit about that?
Yes. So with a lot of things in life are just based on your experience. Like how you feel about things is based on how you've experienced them. And so with my background being a labor and delivery nurse, I've seen what happens when home deliveries go bad. And so I'm a very much risk versus benefit girl. And to me, there is no benefit to the risk of losing your baby or a mama doing a home delivery. That doesn't mean that bad things don't happen in the hospital setting. However, we have resources to intervene and hopefully prevent those bad things from happening. If you have something like a placenta abruption, like your placenta is coming away from the wall, the baby is at risk for hemorrhaging and bleeding out, you have 6 minutes to get that kid out. And so even if you're literally across from the hospital, it's going to take you longer than 6 minutes to get in an OR. And so that just risk versus benefit isn't there for me. I feel I can offer mamas a natural supportive birth in the hospital setting. I've had patients that don't want any interventions, and that's fine. I educate and explain like why, like a lot of our mamas get IVs when you get admitted to the hospital. I've had moms that don't want an IV, and I explain to them, okay, that's fine, but you have to understand in an emergency, it's harder to get an IV started than now when everything is calm and we have time. If you're bleeding out and we need an IV, it's going to be stressful. It's going to be, we may not get it. There's going to be a risk of a bad outcome because we don't have that access already. And if they understand that and they agree to that, then that's fine. The last one that didn't want an IV, she did beautifully. She did not have an IV. She got a little bit of IM Pitocin after she delivered just to help prevent bleeding too heavily after delivery. And it was beautiful, completely unmedicated, very limited interventions. So that's my rationale.
Right. So you talked about when we were talking about high risk, I'm trying to back up and remember, you said something about you haven't really had a lot of that. Is that correct? You haven't had a lot of high risk stuff?
I haven't had a lot of patients that have turned where where I've needed Dr. Tolley's help. I feel like we have this joke that things come in threes. And so I did have a couple that did spike blood pressure issues and they got helicopter rides to Spokane. But other than that, most of my patients do beautifully. So
my guess is one of the reasons why is because prenatal care is super important. So you don't have any surprises at 40 weeks, right?
Right. So yes.
So tell us a little bit about that.
So yes. So prenatal care is definitely a very important piece. There are things that if are caught earlier, then we can treat and manage and intervene. For an example, one of my patients that had the high blood pressure, she had taken her blood pressure at home. And because she had access to me, she was able to send me a picture via text of what her blood pressure was. And she was like, didn't know what to do with that. She's not a medical professional. She's like, she knew it was high, but she was like, do I take more medicine? Do I go to the ER? And her blood pressure was so severe. I was like, you go straight to the hospital. And so I feel like that particular patient could have stayed home and could have had a seizure because she didn't have the access to me to tell her like, no, let's go to the hospital. And we were able to intervene and get medicine on board sooner than later.